Good afternoon, ladies and gentlemen.
Mr. Chair.
Welcome to the Senate Finance Committee. Today is Wednesday, April the 1st. And the first bill we will hear is HB 999, sponsor only, Delegate Clippinger. You may begin when you're ready, sir.
Thank you very much, Madam Chair, members of the committee. House Bill 999 is an alteration to the Class 9 liquor statute. Class 9s are like the craft distilling portion of, they are the craft distilling portion. That's a small distillers. And they get a certain number of gallons a year that they can distill. This would allow them to have a second to manufacture or rectify a product for another distiller with part of that capacity. That's not growing their capacity, it's just allowing them to work with other people, to use capacity they have to build partnerships and to strengthen their business. And so that's what House Bill 999 did. I would certainly appreciate the support of the committee.
Thank you. Are there any questions? Seeing none, thank you so very much, Delegate Clippinger. Next, we're going to hear from Delegate Clippinger again on House Bill 1425.
House Bill 1425, and there's representatives here from the Liquor Board if you have any further questions, but it makes technical changes to the alcoholic beverage license deadlines when fees have to be paid by the holders of certain licenses in Baltimore City. There was a cross-file from the Senate. This bill is in exactly the same posture as the Senate bill.
Thank you, Delegate Clippinger, and we have received a Senate delegation letter. Are there any questions for Delegate Clippinger? Seeing none, that ends the bill hearing on House Bill 1425. Thank you so very much. Next, we're going to hear House Bill 264, Maryland Data Privacy and Protection Act of 2026, and that's the Department of Information Technology.
Good afternoon, Vice Chair and esteemed members of the committee. For the record, my name is Katerina Panyalinin. When I accepted my position as State Chief Privacy Officer in May 2023, I recognized that as we expand digital services and data sharing capabilities, we must equally be diligent in protecting the personal information of the Marylanders we serve. We have the opportunity to modernize Maryland's privacy standards to ensure the state handles data not just efficiently, but with the highest levels of integrity and transparency. House Bill 264 establishes best practices for how state units manage personal information. It strengthens oversight of the data ecosystem by requiring agencies to include strict privacy protections in contracts with third parties that process personal information. Crucially, the bill broadens the definition of personal information by incorporating sensitive data, which includes identifiers related to protected classes. Elements include gender identification, citizenship, immigration status, information about a child, and specific geolocation information. These updates are essential for preventing harm from the sale or unauthorized redisclosure of personal records and for discouraging the development of secondary commercial markets for Marylanders' private information. Additionally, the bill limits collection of personal information to only the minimum amount necessary to meet a legitimate government purpose. It mandates data be accurate, current, and securely deleted or de-identified once it no longer is needed. By requiring each unit to post clear privacy notices and designate a privacy officer, this legislation ensures transparency for the public and internal accountability for data stewardship. For these reasons, I respectfully ask for the committee's support of House Bill 264. Thank you for your time, and I'm happy to answer any questions.
Absolutely. Thank you so much for your testimony. Are there any questions? Seeing none, thank you so very much. This ends the bill hearing on House Bill 264. Is Delegate Lopez here or a representative from our office? You may come on up. We're going to start with House Bill 989.
Good afternoon. I'm Emily Charlap. I am Delegate Lopez's Chief of Staff, here to present House Bill 989. This bill reflects a simple idea. When we help older Marylanders stay in their homes that they know and love, we support communities and protect our state's fiscal financial future at the same time. This bill reviews the possibility of allowing income that seniors receive from renting a portion of their primary residence to be exempt from the calculation of income for age-specific state medical and housing programs. We've all heard the reality from the Department of Aging. Marylanders are getting older rapidly. Research from the University of Maryland and projections from the Maryland Department of Planning show that older adults already make up a significant share of our population, and that share will continue to grow for decades, up to over 25% of the population by 2040. At the same time, most older adults want to remain in their homes as they age. AARP research consistently shows a strong desire to age in place. The Centers for Medicare and Medicaid Services has found that home and community-based care is generally more cost-effective than institutional care. In addition, the Centers for Disease Control and Prevention has highlighted that social connection plays a major role in improving health outcomes, safety, and quality of life for older adults. Maryland is already responding to these demographic changes through the Department of Aging's 10-year plan, Longevity Ready Maryland. HB 989 builds on those efforts by adding a practical policy that helps seniors remain stable in their homes while maintaining access to essential supports. Many of our seniors rely on programs such as housing assistance, energy cost programs, and Medicaid home and community-based services to remain financially and medically stable. But current income calculations can unintentionally create a benefits cliff. Even modest rental income from a spare bedroom can push someone over eligibility thresholds, resulting in the loss of assistance that is often far more valuable than the additional income that they earn. In effect, the system can discourage seniors from using the very resources they already have, their homes, to improve their financial stability. HB 989 addresses this issue in a targeted and responsible way. It does not expand eligibility or bring new individuals into these programs now or in the future. The age and income requirements would remain unchanged, and this bill does not alter overall eligibility thresholds. Instead, it simply ensures that modest rental income from a primary residence is treated in a way that prevents current beneficiaries from being unintentionally pushed off assistance. As a result, this policy is not expected to drive new enrollment or increase demand on limited program resources, but rather to stabilize participation among those already eligible so they are not penalized for modest efforts to support themselves. As amended, HB 989 focuses the solution on state housing assistance programs and medical assistance programs for older adults. This refinement makes the bill more workable while preserving its core purpose, ensuring that modest rental income from a primary residence does not jeopardize access to critical supports. The bill also includes a thoughtful framework. It does not implement any immediate changes to eligibility, nor does it commit the state to future program expansions or increases spending. This legislation also addressed Maryland's broader housing challenges. According to the National Low-Income Housing Coalition, our state continues to face a severe shortage of affordable housing. At the same time, many older homeowners have unused bedrooms or living space that could help meet this demand. By allowing that space to be rented without jeopardizing eligibility for essential assistance programs, HB 989 unlocks a fast, low-cost source of housing supply using homes that already exist in our communities. This approach not only expands housing options, but also supports independence for older Marylanders, reduces pressure on long-term care systems, and promotes healthier aging outcomes. When seniors share their homes, research like the CDC also shows improved social connection, which is linked to better physical and mental health, reduced isolation, and increased safety. HB 989 is a practical, balanced policy that helps Maryland meet two pressing needs at once, supporting aging in place and expanding affordable housing supply. It is a solution grounded in common sense, fiscal responsibility, and compassion for our aging population. At the time of the House committee, we had a realtor run a MLS listing for individual rooms that were available for rent across the entire state. At the time, there was only 440 such rooms available on the MLS, which shows that there's just not enough of this type of low-cost housing available across the state. For these reasons, I respectfully urge a favorable report on House Bill 989, and I will answer any questions. Thank you.
Thank you. That was an extraordinary job. All of that explanation, I thought it was a long bill. It's 2 pages. You did an excellent job. Thank you so much. Are there any questions? Seeing none, thank you so very much. That ends the hearing on House Bill 989. Next, you're going to present House Bill 1117.
Yes, I am. Okay. If you thought that one was a lot. At its core, this bill is about making sure our law reflects the realities families are already living every day and giving our systems the clarity they need to respond effectively. Across Maryland, families caring for loved ones with autism or dementia diseases live with a constant concern that, in a matter of seconds, that person can wander from a safe place and find themselves in danger. This is not a rare or hypothetical scenario. It is common, it is urgent, and when it happens, every minute matters. For some additional context, nearly 50% of children with autism will elope at some point. Drowning remains a leading cause of death in elopement cases involving children with autism. 60% of individuals living with dementia frequently wander, often becoming disoriented and risk of injury or death. The Alzheimer's Association has reported that Maryland leads the nation in Alzheimer prevalence among individuals age 65 and older. When someone goes missing due to elopement, the consequences can escalate quickly, whether that's exposure to traffic, environmental hazards, or tragically drowning. And when those incidents occurs, families and first responders are forced to a race against time, often starting with very little information. Now, we know that technology can change that equation. Elopement response devices, often GPS-enabled, allow caregivers and emergency personnel to locate individuals quickly and accurately. They can turn what might otherwise be a prolonged and dangerous search into a rapid recovery. For families, they offer something just as important, a measure of peace of mind and the ability to support independence without sacrificing safety. This bill is a part of a larger effort of 5 bipartisan bills called the LEAD Act. These efforts are designed to address elopement emergencies across the lifespan through a comprehensive framework focused on access, coordination, and training. HB 1117 plays a critical role within a much larger, thoughtfully designed system that includes caregivers, medical professionals, educators, and first responders. Originally, this bill was aimed at access through coverage, but as amended, it takes a different and in many ways more fundamental approach. Instead of creating mandates, HB 1117 establishes something just as important: clarity. It creates a clear, consistent definition of elopement response devices in Maryland law and classifies them as assistive technology or medical safety devices. That might sound technical, but it has real implications. Because when something is clearly defined in statute, it becomes easier for agencies, providers, and families to operate from the same understanding. It reduces ambiguity, improves consistency, and creates a shared language for decision-making. The placement of the definitions in both the Health and Human Services sections of Maryland Code do something subtle but important. They bridge systems that are often siloed, aging, disability, and public health, and ensure that this issue is recognized across all of them. HB 1117 simply aligns our statutes with the tools and needs that already exist and create a foundation for better, more consistent policy decisions in the future. And sometimes that's exactly how good policy works, not by overreaching, but by getting the fundamentals right so that people can actually use the tools available to them and better decisions can follow from that clarity. HB 1117 has been thoughtfully amended to ensure no fiscal burden to the state while still preserving its life-saving intent. This was followed by a unanimous subcommittee support and vote in the House Committee, after which all members signed on as co-sponsors, reflecting a broad bipartisan alignment. HB 1117 then passed unanimously on the full House floor. So while this bill is modest in scope, it is meaningful in impact. It recognizes a real risk, acknowledges a real solution, and ensures our laws speak clearly about both. I respectfully urge a favorable report on HB 1117, and I am free to answer any questions.
Thank you so very much. Excellent testimony. Are there any questions? Seeing none, this ends the hearing on House Bill 1117. Thank you so very much. Delegate, I'm sorry.
There was a testimony from MDOD. I'm the coordinator of autism strategy.
Oh, that's fantastic. This is sponsor-only hearing, and so we have the written testimony here. Thank you. Next, we're going to hear House Bill 1241. Delegate Acevedo.
Good to see you.
Good afternoon, and thank you, Mr. Vice Chair and members of the Senate Finance Committee. For the record, my name is Delegate Gabriel Acevedo, and I'm here to present House Bill 1241, which is a thoughtful update to Maryland's bereavement leave law. Under current statute, employees may only use earned paid leave in the event of a death of an immediate family member. This bill modernizes the law by allowing employees to use bereavement leave when they experience the loss of an individual with whom they had a qualified relationship. This legislation reflects a broader and more accurate understanding of what families look like today. The inclusion of relationships by affinity is intentional as the concept of affinity comes from a legal understanding and recognizes that family is not always defined strictly by blood or formal status. It reflects the real relationships that provide care, stability, and support. House Bill 1241 ensures that employees can take bereavement leave not only for traditional family members, but for individuals whose close association is equivalent to a family relationship. This moves away from a narrow definition of family that does not reflect the reality for many Marylanders. At the same time, this bill is carefully balanced. It does not tell businesses how to define family within their policies, and it does not create a new category of paid leave. Instead, it expands the definition so that employers are put in the position of defining family or extended family within their own policies. Additionally, while employers are able to use leave they have already earned, the amended bill also allows for unpaid leave in accordance with an employer's existing policy. Grief does not follow rigid definitions, and loss is not limited to traditional categories. This legislation is about compassion and making sure Maryland law reflects the realities of modern relationship. House Bill 1241 is a practical measure that supports workers during some of the most difficult moments of their lives while maintaining flexibility for employers. It is for these reasons, Mr. Vice Chair and members of the Senate Finance Committee, I respectfully urge a favorable report on House Bill 1241, and I thank you for your time. Happy to answer any questions.
Thank you. Are there any questions for Delegate Acevera? Seeing none, thank you so very much. This ends the bill hearing on House Bill 1241. I'm going to call the legislators that are in the room that I saw as they arrived. Delegate Woods, it looked like you're presenting 3 bills on behalf of the Prince George's County delegation. We'll hear House Bill 406, I apologize.
All right, can I bring, you said which one?
House Bill 406, Prince George's County alcoholic
Can I bring
beverages.
members from the delegate from Prince George's County up, or? I'm not
Sure,
how
but
that-
it's sponsor only. They could just
Okay,
come up
that's
in case
fine.
there's any questions.
Okay, if there's questions. Let's see, we're doing House Bill 406. Good afternoon, Chair, and members of the Senate Finance Committee. I'm Delegate Jamila Woods, and I'm here to present House Bill 406, PG 313-26. This bill provides that while a person or premises may generally hold only one board-issued license, the restriction does not apply to Class B on-sale beer and wine licenses or Class B on-sale beer, wine, and liquor license in Prince George's County. There was a similar bill establishing an exception from the prohibition against issuing multiple licenses to the same person or premises in Prince George's County. That was introduced back in 2020. It was HB 281. This bill has been voted favorable through the Prince George's House delegation, and also favorable through the Government, Labor, and Elections Committee, and so we're asking for a favorable response.
Thank you so very much, Delegate. We do not have a letter yet from the Senate delegation. If you could just make sure we get that, we'd appreciate it.
Okay.
Are there any questions? Seeing none, this ends the bill hearing on House Bill 406. Next, you have House Bill 582.
Thank you again. House Bill 582 is Prince George's 318-26. Again, for the record, I am Delegate Jamila Woods, and this bill repeals a requirement for certain alcoholic beverage licenses in the county that require that individuals be a registered voter in order to apply for or sign a license application on behalf of certain entities. The full summary says that to apply for a sign or an application for certain licenses related to alcoholic beverages in Prince George's County, the applicant must be signed by an individual who is a registered voter, among other requirements. Applicants are already required to be residents, and so we're asking to repeal the registered voter. And this bill also was favorable in the Government, Labor, and Relations Committee, and also with the Prince George's delegation.
Thank you so much for your testimony. Is there any questions for Delegate Woods? Seeing none, thank you so very much. That ends the bill hearing on House Bill 582. Next, we will hear House Bill 583.
Thank you again, Delegate Woods. And I'm presenting House Bill 583, PG 19-26, Prince George's County Alcoholic Beverages Notice of Issuance of Class C per diem beer, wine, and liquor license. Under existing law, when the Board of License Commissioners for Prince George's County issues a Class C per diem beer, wine, and liquor license, the board must notify various personnel in the county, including the director of the county's Department of Environmental Resources, as so-called, and state this bill updates the name to the Department of Permitting, Inspections, and Enforcement. So this is just a name change. I ask for your favorable review.
Excellent. Thank you. Are there any questions for Delegate Woods? Seeing none, thank you so very much. That ends your last bill hearing on House Bill 583. Delegate Woods, if you could just make sure that we get letters from the Senate delegation, that'd be great.
Thank you so much.
Thank you so very much. Next, we're going to hear from Delegate Emery on House Bill 1456.
Thank you very much, Chair, and all the members of the committee. I appreciate being here. House Bill 1456 is another approach. We're all, I know, concerned about squatting issues across the state, and I use squatting in the most general sense because obviously there's lots of scenarios involving people who are duped and believe that they're legally in a property and then others who don't. And so Delegate Boyce and I had a situation in our district, and the person who was in the property had signed a fake lease that had been created by a woman who was advertising the lease on Instagram. And so in a series of meetings with many of the people who have submitted supportive testimony, including the Sheriff's Office, Public Justice Center, and many others, this idea came up. And it was Matt Hill from the Public Justice Center who had the idea. And we found that New York State is also pursuing this, but no other state. And it goes after the platforms where these fake leases and fake deeds are being promulgated. And so what the bill says is that if you are a commercial entity allowing people to put their leases and deeds, offering homes to rent or sell, you have to verify that, in fact, the person posting has authority to do so. And we clarified it's any entity, but it would include specifically social media platforms because Facebook and Instagram are the two main locations where this happens. And it provides for enforcement through the Consumer Protection Act. So it would constitute an unfair or deceptive trade practice, which maybe it already does. There are lawsuits that individuals have brought, but this would make it clear that that's the procedure for enforcement. The Attorney General could bring suit. It also requires that they save the verification for 3 years so that protects them if they are, in fact, there's an enforcement action, but also allows the enforcer or the person who's a victim to obtain that information. We made amendments on the House side. There were questions brought by the realtors, and they are now in support. So we made clear that if a posting is created or republished with the consent of any licensed realtor or other agent, then it does not need to be verified. That would suffice as verification. And the bankers at the last minute focused on it and realized, the way we've defined owner and agent of owner doesn't necessarily include a bank if the property's in foreclosure. It also might not apply to a guardianship situation, so we've added language, and I think you'll be receiving a letter from Bob Enton now in support of the bill with that amendment. So I think it's a really both important but also novel step to address one piece of this problem. It's not going to solve the entire problem, but I think it will help us manage it and keep and have the platforms, instead of them adding to the problem, they'll be part of the team trying to prevent it. So that was the genesis of the bill and how it has gotten to this place, and I hope you will support it. We have, again, worked through it so that we have now, I think, unanimous support from the organizations, at least, that have been involved.
Thank you, Delegate Emery. Question, you mentioned social media. What about other electronic platforms like, say, Amazon or more mainstream?
It would apply to all of them.
It applies to them as
Absolutely,
well? Okay,
yes.
thank you. Are there any questions from Delegate Emery? Seeing none, thank you so very much.
Thank you so much.
This ends the bill hearing on House Bill 1456. Next, Delegate Ann Healy, House Bill 1504.
Thank you, Mr. Chair. I'm Delegate Ann Healy. For the record, testimony in support of House Bill 1504. This is a second introduction. This bill in a different form, a slightly different form, passed unanimously from both houses last year and was vetoed by the governor. Since then, I have worked with State Highway, and we came to an amendment that they are satisfied with, and I am satisfied with, that identifies the funding source within the department, and everybody seems to be happy. What the bill does basically is it prioritizes the funding for the construction or reconstruction of sidewalks and bicycle pathways adjacent to highways that are subject to a complete street policy or a similar Vision Zero program. And it's a very simple bill, and as I said, passed unanimously before, but the State Highway had some misgivings, and we fixed that. So the other thing that happened in the House when this bill was brought up for a vote, this surprised me. They actually decided to name the bill after me. As you know, this is my last session, this is my last bill, and my committee mates really shocked me by doing that, and that's why it says what it does as the name of the bill. So with that, I hope that I can get your support second time around. Last year, this bill came out unanimously out of JPR. I understand that there's been a shuffling, as there has been in the House, of subject matter. So I know that you're hearing this for the first time as a committee, but I know that every senator voted for it last year. So I hope that I can get your support again now. That's all.
Thank you, Delegate Hilly. Are there any questions? Senator Ellis.
Thank you, Mr. Chair, and thank you, Delegate Hilly, for this bill. We'll make sure that your name stays on it and it's recorded forever in history, right? Yeah, we'll do our part. Quick question, any connections with like school zones with this bill? Does it talk about?
It's the Vision Zero that we're focusing on, which is, and these priority funding areas and the places where the Complete Streets programs are in place, which is trying to find safety for everybody.
And Vision Zero is? Not everyone know what our
Vision Zero means we want to get to the time when there are no pedestrian deaths on the highways of the state. Right. That's the zero that we're going for.
Right. And any effect of, say, special consideration for, these myriads of schools.
Well, they've been dealt with
that have no sidewalks leading to them.
Well, most of them are in those kind of zones, I would think, I would expect. I know that they are, if they're in a municipality someplace, or if they're in an area that has been designated where there's a dangerous situation, then that would get the priority.
Yeah, okay, great, thank you.
Thank
you, Mr. Chair.
Thank you. Are there any additional questions for Delegate Hilly? Delegate Hilly, on behalf of Chair Bidle and all of us here at Senate Finance, thank you so much for your years of service. You've contributed so much, and we're going to do our best to work on this bill in committee. Thank you so very much for your testimony.
Thank you, and of course, I'm ready, willing, and able to talk to you about it at any time. Thank you.
Indeed. Thank you. This ends the bill hearing on House Bill 1504. Next, we will hear from Delegate Taylor on House Bill 558.
Thank you, Mr. Chair. For the record, I'm Delegate Kim Taylor, representing Prince George's County's District 23. House Bill 558 is a Prince George's County delegation bill that simply lifts a restriction on the number of wine festivals licenses that are issued each year in our county. Today, Prince George's County is restricted to one wine festival license per year. I know you're wondering why. I don't know why. But what we do know is that no other jurisdiction in Maryland has the same restriction. And further, on page 2, section E, there's another restriction that says District 24 should never be considered as a location for a Prince George's County wine festival. So with the full support of our District 24 colleagues, we have struck that restriction, and you should see that in the amended version of this bill. Just further, this bill does not open the floodgates for wine festivals. There's still boundaries that exist, and the Board of License Commissioners or Liquor Board will continue to work within their applicable guidelines for granting wine festival licenses. I urge a favorable report. Thank you.
Thank you. Are there any questions for Delegate Taylor? Seeing none, thank you so very much.
Thank you.
That ends the bill hearing on House Bill 558. I'm going to ask Delegate Ebersol to come up. He has sponsored only. I do see Delegate Boafo and Delegate Wims, but both of your bills have other people to testify, so we're going to get Delegate Ebersol out the way real quick.
Thank you so much for your consideration, Mr. Chair. For the record, I'm Eric Ebersol, representing the Baltimore County delegation on House Bill 1474. This bill converts certain Class B beer, wine, and liquor licenses that have been transferred legislatively in Baltimore County from a specific transfer license back to regular Class B beer, wine, and liquor license. The transfer licenses have been granted by the legislature when requested by various administrations beginning in the early 90s. Upon the transfer, the license were included in the population quota system. In the district they were transferred into, the licenses are varied slightly on percentages and food sales required and limited the license and the exact location. And I'm doing it like this because it's very complicated. And this bill is designed to simplify the Class B license law in Baltimore County. The Baltimore County Liquor Board and the Baltimore County Licensed Beverage Association have worked together on this bill to simplify the multiple categoric Class B licenses currently existing and included in the population quota system into regular Class B beer, wine, liquor license that will all be treated the same. This does not include any exception licenses under Rule 19 of the board's rules and regulations. This will make the regulatory system more user-friendly and allow laymen to understand it. This bill has been taken up by the Senate delegation, and I believe you have a letter of support from them.
Thank you, Delegate Ebersol. We are in receipt of the letter from the Senate delegation. Are there any questions of Delegate Ebersol? Seeing none, thank you so very much.
Thank you so much,
This is the
Mr.
bill
Chair
hearing on
and
House
committee.
Bill 1474.
What does that guy want? I want to know right now. Does he just want a hug? Is that
He's
what he
the
really
special
wants?
one in the class.
He just wants a hug.
Thank you. That ends the bill here on the House Bill 1474. Next, we will hear from Delegate Boafo on House Bill 994. This is a bill that's familiar. You could take either the table or the podium, whichever you prefer.
I've been sitting all day, Mr. Chair. I'm going to stand. Mr. Chair, Mr. Vice Chair, members of the Finance Committee, for the record, Delegate Adrian Boafo here to present House Bill 994, the Don't You Worry Act. I'm pretty sure you guys are all very familiar with this bill, and I want to thank Senator Guile for her leadership in carrying this bill last year. As a refresher, this bill strengthens consumer protections by requiring travel agencies operating in Maryland to register with the Department of Labor and meet clear financial responsibility standards before serving their customers. Right now, unfortunately, in Maryland, there's very little oversight for travel agencies. And when things go wrong, families are left with no real recourse. You heard this again firsthand last year from the remaining members of the Worry family. To remind you, this was a family who was scammed during a religious pilgrimage and left without the services they paid for and lost their lives as a result. And because this bill only passed one chamber last year, Maryland families are still being targeted by travel scams. This past year in my district, a constituent paid over $4,000 for a trip that never happened. She tried to get answers, but the agency shut down, no refund, no trip. In another case, a Maryland couple planned a destination wedding and booked travel for more than 60 guests. Families paid thousands, but there was no flights, no reservations, no trips. And this isn't just a few isolated cases. In one instance, a single Maryland travel agency took over $400,000 from hundreds of customers across our state, and those trips never happened as well. And without basic oversight, bad actors will continue to keep doing this to Maryland families. Florida, Washington State, California, and other states have already passed legislation like this. Maryland should do the same. No one, and I mean no one, should be defrauded, stranded, or lose their life because of the failed basic protections we do not put in place. And so, Mr. Chair, for those reasons, I urge a favorable report on House Bill 994, the Don't You Worry Act.
Thank you, Delegate Boafo. There was some concern in the bill about hotels being in, but Airbnbs being left out. I don't know if you want to comment on that before the unfavorable panel come out.
Yeah, no, we have talked about it, and I'm pretty sure the unfavorable panel will talk about it. What we are trying to figure out is, if you join Marriott Services, right, they can book travel for you, they can book you a flight, they become more of a travel agent at that point. We're looking into if Airbnb actually does the same thing, and that's why they were exempt last year in the original bill. So we want to kind of understand more about Airbnb's business model and the complexity around what they're doing in the travel space. I am not opposed to putting hotels on the same par as Airbnb if we do find out that Airbnb's business model is similar to what a lot of these hotels are doing.
Excellent. Thank you for that response, Delegate. Senator, did you have no. Are there any additional questions for Delegate Boafo? Seeing none, now we have an unfavorable panel with Frank Boston and James Stark.
I don't see Jim unless he's virtual. Anyway, for the record, I'm Frank Boston III, here on House Bill 994, representing the Maryland Hotel and Lodging Association. And we wish that the legislature had a box opposed unless amended. I mean, we certainly support the bill, the reason behind the bill. I read the story. I saw it on the news. It was horrible what happened to this couple who was trying to live their lifelong dream and go to Mecca and have the experience. So certainly sympathetic, totally sympathetic. We worked a lot on this bill last year with Delegate Boafo, and the hotels are exempt. The way the bill is that we are exempt unless, and we are exempt, and we're even exempt if we provide incidental transportation. Your shuttle goes to the airport and picks someone up, no problem. But we're not exempt if we provide travel services. In other words, the excursions, the day trips, and we receive direct or indirect compensation from our participation in those services. And that was we sought to be totally exempt last year, and the good delegate said, no, if you're in the business of providing those types of services, then you need to be in the bill. So, we said okay, and we were fine with it, and we didn't take a position or oppose it in the House. But we looked up and we saw the amendment which allows short-term rentals, the Airbnbs of the world, to be completely exempt from the bill. And we're saying, wait a minute, this should be a level playing field. If they are exempt, then on page 4, strike lines 4 through 10 and totally exempt us too. Or put them in the same category that if it's incidental, then they are exempt. But if they are receiving indirect or direct compensation, then they should be roped into the bill. So we have, Amy Rohr, who can't be here because she's out of town, I said we need examples so that we can provide. So, on her own trip, when she's in Asheville, ironically, because of where she is with her kids on spring break, there was no hotel, so she had to stay in the Airbnb. She sent me her actual experience from the Airbnb she booked, and I have this for the committee, and I've shared it with Delegate Boafo. It's, Asheville Trails and Taps and Trips popped up when she went to book her room. It says, discover experiences for your trips. Salem, Baltimore, discover experiences for your trips. But what's most important is it says for experiences, we typically charge a host 20% service fee. So, and they say this is based on the price of the service.
Frank, you should be wrapping up soon.
Yep. Bottom line is Airbnbs and the platforms charge a service fee, and they say it's based on the price for the service or experience, and is automatically deducted from the payout. So we just want to be on a level playing field, and we just ask for that amendment. With that amendment, we would no longer oppose the bill.
All right, thank you, Mr. Boston. Question from Senator Washington.
Thank you.
this is, I want to thank Adrian Boafo for.
I know I can say it most of the time, but in front of the mic, I goof it all up.
For this bill, but thank
Boafo.
you also, Frank, for Mr. Boston for being here too. So if you don't want to be in the bill, but you also want Airbnb to be in the bill too?
No. So we're saying level playing field. Treat all lodging platforms and establishments the same.
Okay.
The way the bill came out and the way it is, we are actually exempt unless we provide, the excursions, a travel service. Hey, we can plan a day trip for you to take this Jeep tour over to the beach and go sailing, and we receive a fee. Then we are no longer exempt because now we are, as the good delegate explained to me last year, we are providing a travel service. We're acting like a travel agent. I get it. So we're exempt unless we do that. We're exempt if we do a little transportation. The shuttle takes you over to, to the tourist area and waits for you and brings you back, or takes you to CVS or me. That's incidental.
Yeah.
We're still exempt. So we understand that. But this year's bill came over with Airbnb, short-term rentals, Airbnb being an example, being totally exempt. So if they provide travel services, they aren't roped back in. And so we're saying, put us on the same playing field, either totally exempt us like the Airbnbs of the world, or give them the same qualification that we are under.
Got it. And what amendment are you looking for?
Huh?
What amendment are you looking for to be in support of the bill? To get you guys out of the bill?
Amendment 1 would be on page 4, strikes lines 4 through 10, or which would take us totally out of the bill.
Right.
But I did, Delegate Boafo and I spoke yesterday, and I do understand his reasoning for keeping like the hotels or short-term rentals in the bill if they provide the travel services.
Yeah.
So therefore, secondarily, I am asking for Amendment B, which would be to add them into the same language that applies to us, which would be putting a comma on line 3 and adding short-term rentals in their hotels.
What's the burden that you guys are having with this bill that you'll see if you have this bill move forward? Like, what's the burden that's going to be on these companies that you're afraid of, that reason why you want to be opted out? What's the burden that this bill puts on these companies that you represent?
I'm not sure it's a burden. The bill requires a fee to
$300.
The bill requires a couple of things: a surety bond and a fee. We don't care about the surety bonds because most hotels already have a bond. Right. They have adequate insurance.
And there's a $300 fee.
And the $300 fee is the administrative cost, I guess, to go to the departments to run the program.
Okay.
So it's not so much a $300 fee as the burden. It's just being on the same level playing field, and that's what it comes down to. If you're going to exempt one part of the lodging industry, they exempt the other part of the lodging industry. Yeah. If you're going to keep one part of the lodging industry in the bill, keep the other part of the lodging industry in the bill.
But the registration fee isn't that bad, and the surety bond you already have. Is that right?
Yeah, they would definitely have to have insurance. Now, I can't speak for each hotel as to which type of surety or bond that they have, and I don't know whether it covers any specific types of travel services. And I should back myself up because I can't speak for each hotel's business model as to whether the $300 fee is significant or insignificant.
Some big
personal opinions.
Some big chain hotels you represent, sir. So thank you.
Not
very
all
much.
of them are big. You got some mom and pops, and then you got some of our members are also some of the bed and breakfasts and stuff.
I appreciate it. Thank you.
Yeah.
Senator Ellis.
Thank you, Mr. Chair. Thank you, Frank. Tell me if you've ever heard this question before. So I understand your position representing your client, right?
Right.
With the issues of travel in certain parts of the world is very dicey, right? With what happened with the Maryland residents who went on this pilgrimage to Mecca. and basically they got to a strange place, and things were not as promised, and they ended up losing their life. I just want to say personally, I went on an African pilgrimage last year, and it's not like traveling in America. It's not like traveling in even Europe. It's very much more disorganized than organized. And so I'll ask a question this way. I know you're doing your job. Outside of your job, as a person who would say go on a trip to one of these places, personally, just, Mr. Frank Boston, wouldn't you love to have these protections in law to cover you and your family? I mean, step outside of your role as representing the industries, right? We know you kind of do your job.
Yeah.
But personally, wouldn't you love to have that protection, not have whatever happened to that mother and father, husband and wife,
right,
and their Hajj happen to you or your family?
Oh, 100%, Senator. Absolutely, 100%. And I go back, I watched the news that night, and I looked at my wife and said, oh, my God, look what happened to these people. It was sad. 100%. And I think I speak not only for myself, but for the hotel industry as well. We are, our thoughts, our hearts is supportive with the amendment, but we can't sign up this way for this type of hearing because it's only 2 and 2. Support and 2 oppose. So we support the purpose of the bill 100%. Yeah. And we think everyone in the lodging industry should be on the same footing and have to abide by the same rules, whether it's this bill or any other bill.
Yeah, thank you.
Yeah.
We appreciate that answer.
Yep.
Thank you, Mr. Chair.
Yeah.
Thank you. Any further questions for Mr. Boston? I think
Mr. Stark did show up. He's here.
Yeah, so Madam Chair actually just said that Mr. Stark might be out in the back lobby, so she just went back there to see if she could find Mr. Stark. Does he want to come up to?
Yeah, he is here.
Oh, he's right there. Okay, all right.
He did show up. Yep.
So go ahead. Mr. Stark, you're here unfavorable. Come forward and provide your testimony.
Sure, and absolutely. And I just want to thank you to the committee for taking the time to hear this, and thank you for Madam Chairman. I actually ran into her in the elevator. We actually met years and years ago at a golf tournament with a good friend of the industry, Lou Zagarino. And I completely agree with Frank that there comes a time when you want to be very supportive. We agree with the tenets of the bill, 100%. Our biggest thing in being a hotelier, and I represent the Best Western Premier Hotel and Suites in Rockville, Maryland, and I'm also the chair of the Legislative Committee for the Hotel Association. And Amy herself, Amy Rohr, she's the president and CEO. She's actually on vacation with her boys that are on spring break, and she booked a short-term rental. And on that platform, immediately, and I did it again yesterday just to see, they offer lots of add-ons. Which is awesome. Hotels sort of do the same thing to a lesser degree, and so we just want the environment to be, the competitive balance to be the same. And so if we have to conform to certain things, we would ask that instead of being amended out of the bill, perhaps short-term rentals could be amended back into the bill, because I think that's actually where you would capture a lot more of that sort of activity. And it would make it a level playing field for us as well if folks are coming into the area and they're wanting to layer on. We do it as an amenity. Hotels do it as we layer things on as an amenity, not necessarily as a revenue center. Where short-term rentals, if you look at their, the way that they structure, and I'm not sure if Frank touched on this or not, but if you look at how they structure, they make up to 20% off of these layer-ons. On top of. So that's all we're really looking for, is if we're looking to protect everybody and have all the guests traveling to the area to have all the equal, not only playing field for us, but safety for them, that's what we're sort of looking for. And I appreciate the time. I appreciate you letting me back in a little bit late to the party here. And obviously I'll field any questions you might have.
Thank you, Mr. Stark. Thank you for the elevator ride.
Yes, ma'am. Thank you.
We both made it just in time. Before you leave the microphone.
Yes, ma'am.
So sometimes hotels schedule the transportation. Is that what the issue is?
Sometimes hotels schedule transportation, and I'll speak from my experience. And I had a hotel at BWI Airport I sold last year, and now I'm involved at this hotel, very nice, beautiful hotel in Rockville, Maryland. And we help facilitate, right? So for us, it's usually a pass-through with either no markup or a very minimal markup just for consideration. And sometimes you have to make a little bit of a markup for whatever. That's usually what we do. The platforms typically, and it's not really typically, if you go and you just look online and see what's in their own contracts, it's a 20%, what they go to the vendor. I know when I go to the Caribbean and I book something, I book an excursion, I thought they used to own the excursion companies. They don't, and it's a huge markup. So, yeah.
Well, thank you for that. Senator Washington?
Madam Chair, on your question, just for clarification, the bill, if the hotels are exempt, even if they arrange or provide transportation. So if they send their shuttle to pick up somebody at the airport, they're still exempt because it's incidental. It only ropes, and if they, you say, oh, I need to get Motrin, and they take you down to the CVS or wait for you to come back to get your prescription. That transportation is still exempt. It's only if they provide direct or indirect, if they receive direct or indirect money or compensation for valuable consideration. And I will profit to say that 20% the Airbnb is valuable.
Thanks for that clarification, Frank. Senator Washington, or did you?
I was going to ask the question, but I think I know the answer to this. So are you against the registration fee, registering with the department if you're providing this service?
Are
you against? Is it your position that you're against a portion of this bill that if you offer these services that you have to register and pay a fee? Are you against that?
I'm not necessarily saying that we're against that. We're essentially saying if you're trying to capture and achieve what you want to achieve, it's not just us. It's probably more of the short-term rentals.
I know you want to add. No, Frank told us you want to add more people to it. I get it.
Sure. No. We're not opposed to that. We're not. Trust me. I mean, and all of us are in my number one concern.
So you're
to
not
me is guest
sure
safety.
if you're against the registration fee and the registration with the department.
No, the fee is not the issue.
Okay,
I don't think the fee is the issue.
And then what about the insurance liability that's required by this bill? Are you against that portion of the bill? If you provide these services, then you have to also have this type of insurance.
If it's a level playing field, and I'll be honest with you,
so the issue is about just adding Airbnb or some other companies.
If it's a level playing field, then we're okay to go that. But if it's something that all of a sudden puts us in direct competition or to where we're at a disadvantage, then we'll essentially have guests that call us that we want to really help out. We'll have to hand them a list of say, listen,
what puts you at a disadvantage as a company to register your business or your entity with the state and ensuring you have an insurance liability? How does that put you at a disadvantage?
If it increased my cost above that of a third party, a short-term rental, then that would put me at a disadvantage to where I could not offer that. I call it an amenity through my sales department. I would essentially say, hey, listen, here are 3, 4, 5 great people we'd recommend in the area.
So now this
you
bill
book directly, that way it's out of our hands.
So now this bill is preventing you from offering those services because you don't want to either pay the fee or have the insurance?
Anything that will put us at a competitive disadvantage with any other party that we have to compete against, the industry, any industry, not just our industry, but industry with every conversation you have.
So the issue
would take time.
The issue, what I'm hearing from you and Frank, is that you want Airbnb in here.
Yeah.
In all honesty,
Senator, what happened in the bill is the Airbnbs, the short terms were all excluded, and the hotels were included.
No, I know that. I know that.
Okay,
part.
so
Yeah,
I think what Mr. Stark is saying, treat everybody the same.
No, I get that.
Okay.
And I'm trying to.
And in all honesty, if you're trying to achieve what you want to achieve, you would want to include them because they have more of the exposure to that sort of risk that you would have for guests and the situation that unfortunately happened overseas than what would happen in a hotel. Because it happens more so in that situation than it does in the situation with hotels.
So if,
that's all I'm saying.
Airbnb was added, you guys would be fine with the bill?
If Airbnb is added, I would defer to Frank a little bit, but
we already heard from Frank.
Okay, but if, you know,
We already heard from.
as the chair of the legislative committee, I would say we've always fought for this, not only this situation, but other situations, a level playing field. If there's a level playing field, we'll compete all day long with whatever. That's all we really strive for. And I appreciate the chair's commitment to, you know, you've been a champion of hospitality for a long time, and we should truly appreciate that.
Hey, I love hospitality too, man.
Oh yeah, absolutely. We all do.
We all love hospitality.
Yeah.
We travel all the time and go places.
Yeah,
we all
absolutely.
love hospitality.
Hey, we're getting into,
You know, I think if
crab
Airbnb
and oyster
if
season, yeah.
Airbnb does offer these services and things of that nature, I think there could be, you know, I don't know, I think there's a conversation to be had, but it sounds like you guys really just want Airbnb added to, as you said, level the playing field. I just because you're not against the fee, you're not against the insurance, you specifically want Airbnb and no short-term rentals in this bill.
I love the aspect that you approach it as far as the safety of the guests. And that I think is paramount. I think we all agree to that.
Yep.
So that's all we say is like, if you're going to capture us, capture them. That they actually make more of it than we do, and that actually makes the playing field equal, but it also achieves what you want to achieve.
Yeah, look, we just want people to feel
yeah.
safe when they're traveling, and they're Marylanders traveling from here, that they have someone they can call and talk to, and if they have an issue. And I think it's really important to have this registration. I think it's a great idea for so many people that travel, or at least have the ability to travel. It's their first time traveling, or if they're like this couple that went on their pilgrimage, which is really important to their culture.
Absolutely.
And so I think something like this is a really good step in the right direction. And, you know, hearing that you guys are fine with the other pieces, it's just you need this.
And we actually have the owner of the hotel, for disclosure, Jewish lineage. They do things of that nature. I have two young sons, 6 and 7 years old. I want them to be safe.
Yeah.
I want my family to be safe. I want my mother to be safe if she travels. I think we all do. So
thank you. And thank you. And I love the hospitality community.
Absolutely. Thank you. I appreciate everybody.
Mr. Stark, before you leave the podium, the reason I love hospitality is I think I have 30 hotels in the BWI area.
Yes, ma'am.
They pay a lot of hotel tax to the county. They're like, I think I may have more hotels in one district than any other district in the state. That's why I love hospitality, but I travel too. Mr. Stark, thank you for being here. I know it was a long drive for you today.
Thank you, ma'am. I appreciate it.
I don't see anyone else, so that ends the testimony on Hospital 994. And if the bill sponsor will reach back, we'll talk about how to handle that amendment. Okay? Thank you very much. Is Delegate Chi here, or someone for Delegate Chi is here? You want to come up and do consumer protection, artificial intelligence, behavioral health care? Thank you, Delegate Chi. You also have Carissa Proctor and Allison Taylor with you, I think. Allison was out in the Thank you, Senator. Here she comes. She's coming in. Thank you.
Yeah.
You're part of the panel.
Great. Thank you, Madam Chair. It's great to be back at the Finance Committee. Just the two of you holding down the place. They probably are all in the House, right?
They're all in the House.
Okay, thank you. Delegate Lily Chi here, presenting HB 883, which is a simple bill relating to AI, generative AI, and behavioral health. As we all know, as AI chatbots and conversational tools become more advanced, some are presented as capable of providing mental health or behavioral health treatment, which can cause serious harms and other safety concerns. So HB 883 does two things. One is it prohibits an AI developer from knowingly misrepresenting the system as a behavioral health professional or capable of providing such care, such as therapists, counselors, psychiatrists, social workers, etc. It also requires consumer AI systems to include a clear disclosure to that effect to the end users. So that's basically what the bill does. As we all understand, the rise of generative AI, such as ChatGPT, Gemini, and Copilot, has coincided with a youth mental health crisis over the past few years. So it's not surprising that many youths turn to such online tools, even though the bill is not specifically only targeting youth mental health crisis, but we know there have been increasing incidents where our youth turn to such tools and form harmful relationships, and some even took their own lives. With a federal government that is unwilling to regulate AI, the states are stepping up because we are the backdrop to protect consumers, especially our youth, who are especially susceptible to such harm. Currently, Maryland has no laws or rules governing generative AI, while many other states have enacted a similar legislation or introduced a similar legislation, such as Nevada, Utah, Illinois, New York, California, and Maine. So after this session, we trust that there will be more states joining the rank, and I hope certainly Maryland will be one of them. This bipartisan bill passed the House with overwhelming support, and with that, I urge a favorable report and turn to my panel. Thank you.
Allison, would you like, on either one?
You go ahead. Good afternoon, Chair and members of the committee. My name is Caressa Proctor, and I'm here representing the National Association of Social Workers, Maryland chapter. Social workers are representing individuals, clients in almost every sector that you can think of. So we support innovation, but innovation may never come at the cost of consumer protection. This bill is necessary and timely. Licensed behavioral health professionals complete years of education, supervised clinical training, examinations, continuing education, and more. AI is not licensed. They are not accountable to a regulatory body, and they cannot exercise professional judgment grounded in human relationships or lived experiences or ethical reasoning. I myself am someone with 2 advanced degrees in social work, but since I went the macro route, I cannot diagnose or treat patients. I treat systems, so that may be why I'm here today. But trust me, this is for public protection. You don't want me being anyone's therapist. Because AI cannot read facial cues, body language, understand sarcasm, or provide genuine empathy required by human relationships. This bill is drawing a clear and critical line. AI systems must not be represented as behavioral health providers, and this distinction deeply matters. Individuals seeking help for depression, trauma, or suicidal thoughts are often extremely vulnerable, and they deserve clarity about who or what they're interacting with. Importantly, this bill requires safeguards when AI systems encounter expressions of suicide awareness. At minimum, direct individuals' crisis resources should be appropriately provided to emergency supports. The absence of these protections can result in serious harm and actually has already, with several folks unfortunately taking their lives. This does not prohibit innovation. Instead, it establishes reasonable guardrails that Maryland social workers and the clients we serve allow technology to evolve ethically and safely. So for these reasons, we urge a favorable report, and we are aware that some of our other social work organizations do so as well. Thank you.
Good afternoon, Madam Chair and members of the committee. My name is Allison Taylor. I'm here on behalf of Kaiser Permanente. We support this bill and agree with everything that my colleague and the bill sponsor said. We do have a clarifying amendment that I hope will be thought of as friendly. It addresses a point of confusion that Kaiser has seen with the bill that passed in California that was mentioned by the sponsor. The amendment would, section F, subsection F of this bill states that it's not intended to, behavioral health providers who use these for administrative support functions are not in scope for the bill. Our clarification would be that if behavioral health providers are using these in a complementary or a supplementary fashion to their own treatment over which they have full control, that would also not be in scope. So thank you for the consideration, and I apologize for bringing this in the second chamber.
Thank you. I guess, Allison, is there anywhere in here that defines what is a chat GTP or the chatbot, or what are the definitions?
Yeah, I think companion chatbot is defined, if I'm remembering correct, the right bill here. What it was is developer was defined, and We thought that definition was a little bit overbroad and didn't quite capture, was not clear to us on the scenario that I described. So that was our recommended.
So one concern that's been brought to me before the hearing today was that this would not include ChatGPT, which is what a lot of people use, the way this is written.
Yeah, I think we would agree. Well, we would not object to clarifying that. I don't think that behavioral health providers are using that, or they shouldn't be, because putting any like personal health information into that would be a HIPAA violation. So I think that is a very reasonable clarification.
Thank you. Senator Washington?
Yeah, I just wanted to clarify, because I was also looking for the ChatGPT stuff too. And I saw the term developer, and it says it means a person that offers for sale, sells, leases, gives, or otherwise simply provides artificial intelligence to a consumer in the state. So that is essentially ChatGPT, is that right?
I would think so, but if there's a desire to clarify that, I certainly wouldn't.
I think clarifying could help.
As I mentioned in my statement, generally when we talk about generative AI tools or conversational tools, we refer to ChatGPT, Gemini, Copilot, kind of common tools that people know and turn to oftentimes.
Right. And they're considered they will land under that definition.
Yeah.
I would also mention that there are some companies calling themselves Ashby and Ashley and marketing themselves as behavioral health professionals.
Okay.
Okay. Any other questions for this panel? I don't see any. Thank you very much for your testimony.
Thank you.
We have an unfavorable, Hannah Allen from the Maryland Chamber of Commerce. And then we'll have 3 virtual unfavorable.
Good afternoon, Madam Chair, members of the committee. For the record, Hannah Allen here today on behalf of the Maryland Chamber of Commerce in respectful opposition to the bill. We do appreciate the sponsors' intent here, and we certainly agree with the goal of protecting Marylanders that are seeking behavioral and mental health support. Our concern is that the bill is overly broad and goes beyond that goal. As written, the bill does not apply to just AI tools that are designed for behavioral health. It is capturing, in our read of it, virtually any consumer-facing AI system that might encounter a behavioral health-related topic in conversation. That includes general-purpose tools like voice assistants and customer service chatbots and other platforms that are not designed to provide care and don't claim to. So, we're kind of viewing this as a one-size-fits-all approach that imposes clinical-style requirements on non-clinical tools. We also are generally, we have concerns with the private right of action that the House committee amended into the bill. That is something that we certainly want to see addressed. Significant concerns with that, especially given how broad we believe the bill is written. I will point to Utah. They did pass a bill with the same goal. It did have more specific definitions of developer and other definitions in the bill. So we're happy to work with the committee on potential amendments. But with that, we would urge an unfavorable report. Thanks.
So Hannah, did I hear you say that if we did a bill more like Utah, you could support it?
I think if we removed the private right of action and we worked on the definitions to mirror Utah's, we'd be in a lot better spot, yes.
I appreciate your testimony.
Thanks.
Thank you. And we have the 3 unfavorable, I think. So Tahara Hoops.
Hi.
Hi.
Can you hear me?
We can hear you. Thank you.
Great. Thank you. Welcome. Good afternoon, members of the committee and chair. My name is Tara Hoops. I am speaking on behalf of the Chamber of Progress. We are a tech industry association supporting public policies to build a society in which all people benefit from technological advances. I am here to respectfully urge you to oppose HB 883. The bill rightly targets AI products that misrepresent themselves as behavioral health providers, but its disclosure and safety protocol requirements sweep in every consumer AI product in the state, from voice assistants to coding tools. The results would be degrading everyday products and heavy compliance burdens on tools with no connection to mental health care. Right now, these requirements apply to all consumer AI, not just behavioral health products. The prohibitions on AI misrepresenting itself as behavioral health providers are reasonable and targeted. The problem is in Section 14-5102B, which requires every AI product sold or provided to Maryland consumers to display a disclosure at the beginning of each use and implement suicide detection and crisis referral protocols. These obligations are not limited to systems designed for or likely to encounter behavioral and health conversations. They apply equally to a voice assistant answering a weather question, a coding tool, helping a developer debug some software, or a photo editor, even just applying filters. So right now the amendments retain this universal applicability, and they do not create a risk-based distinction between general purpose AI systems and those intended for behavioral health interactions. Products with no behavioral health functions would need to build and maintain mental health screening infrastructure simply because they use AI. And this is a blanket mandate that treats a coding assistant and a therapy chatbot as though they present the same risk. Basically, a Maryland family using this voice assistant for morning routines would hear, "I am not a human, I am not a licensed provider," before every command, before checking the weather, before playing music, before even setting a timer. Over the course of the day, that would lead to dozens of interruptions for a product. Just to finish up, because I am out of time, even as it is, it fails to adopt a targeted risk-based framework. And as previously mentioned, if we were to move more to a Utah type framework, we would be happy to review those amendments and possibly change our current stance.
Thank you. And Margaret?
Good afternoon, Chair Beidel and members of the committee. Margaret Durkin with TechNet here to speak on House Bill 883. We agree with the underlying concept to protect Marylanders who are seeking behavioral health care support. However, we do have concerns about this bill. This bill would require every AI system to provide disclosures at the beginning of each interaction and implement suicide protocols, even if an AI is not designed for providing behavioral health care. As mentioned previously, an example of an unintended consequence of this bill would be a voice assistant that households may use for checking the weather or setting timers would have to announce before answering any questions from a consumer in the household, "I am not a human." This would disrupt the seamless user experience. We are also concerned about the private right of action that was added into the bill as passed by the House. And regarding Utah, that would be something I would have to take back to my members to review any potential changes. For the reasons stated above and in my written remarks, we are opposed to House Bill 883. Thank you.
Thank you, Margaret. And now we have Megan Stokes.
Good afternoon, Madam Chair, members of the Senate Finance Committee. I will not repeat the other comments from my colleagues, but we are in opposition to this bill, which is unfortunate because we do feel that the intent is correct to look at specific systems that are being harmed. The discussion about the Utah bill is one that is very interesting to us and is something we've been having ongoing conversations with the sponsor, and I do appreciate the work that they have done on this so far. If that measure was to be, if this measure was to be modeled more like the Utah bill and removal of the private right of action, we would absolutely be able to remove our opposition to this bill. Thank you. I'm ready to answer any questions you may have.
Thank you, Megan. Do I have any questions for the virtual panel? Seeing no questions, we appreciate your comments. Thank you. That ends the hearing for House Bill 883. I think we have one bill. I wasn't here earlier, but. Okay.
House Bill 191.
All right. House Bill, getting there. House Bill 191. Delegate Wims, Consumer Protection Retail Transactions for Essential Goods. Thank you. Yes, your panel may come up. I have Lonia Muckle as your cash campaign in Maryland. And instead of...
Speak directly. I don't need to touch anything. There you go. Thank you, Madam Chair and Mr. Vice Chair and distinguished members of the committee. Finance Committee. For the record, I'm Delegate Greg Wims, presenting House Bill 191, Retail Transaction and Essential Consumer Goods, Cash Payments. This bill aims to address the increasing problems that a lot of my residents are having and those in the state of Maryland when it comes to using cash to buy clothes, food, and medicine. The bill was passed in the House on a bipartisan form. And what the bill says is that cash transactions will not exceed $300. The bill requirements would put it as stated. A telephone, a mail or internet transaction would not be affected. A vending machine or kiosk transaction would not be affected. The transactions of a merchant that sells primarily food or beverage or on-premise consumption, dine-in restaurants. A merchant that sells specialty foods. There is also a sponsor amendment that I just put in yesterday, and I think you have it today, that would exempt those membership companies like Costco and Sam's Club that buy gas. The bill would also allow merchants from prohibiting cash payments if the cash denominations are greater than $20. We brought that in because when we talked to certain merchants, they were afraid that they had denominations of $50 or $100 that may cause a problem. We also put in that the merchants could put a reversible ATM machine in, so therefore that the people with cash could use that without a fee. Portions of the bill were modeled after the successful cash requirement policies instituted in New York and New York City. I want to say at this point, the reason I brought the bill, and the reason it's 191, we put the bill in as a pre-file, but the idea came from, I'm a member of the Veterans Caucus for the House and the Senate, and a veteran brought this bill to me in the summer. He served this country honorably, and he got an injury, so he worked as a flagman for a construction company, and he's still there. But what he said was because he couldn't afford the fees on a credit card, that he had to use cash, and in one particular store, he found that they would not accept cash, and he brought it to my attention. But then at my church, and I have a church, Goshen United Methodist Church in Gaithersburg, our lay leader for the Methodist men, who works at Costco's and as a tar replacement person, asked me when he found out that I was in the Maryland General Assembly if we could do anything to make sure that when he wants to buy food and medicine, that he could use cash. He had run into some of the same problems. So what I'm saying in general is this bill 191 would have the support, if I had gotten it in later, from the Veterans Caucus. It would also probably have support from many other of the caucuses in the House and the Senate. Because as we found, and as you'll hear later from my panel, there are approximately 200,000 people who are now unbanked. That means there are 200,000 Marylanders that don't have a credit card, 200,000 Marylanders that use cash. But just yesterday, as I was talking about this bill with a colleague in the House, they reminded me that the federal government has laid off 20,000 people. So 20,000 federal workers have been laid off. So that number is probably higher now because most of them probably have not received an additional job or may not have been given their job back with the federal government. So with that, we see in Maryland, there are a lot of people, we're talking about 200,000 plus, that actually use cash now when they're buying medicine, clothes, and food. So with that, Madam Chair and Mr. Vice Chair, we ask for a favorable report for House Bill 191. Thank you.
Thank you, Delegate. Lanya, would you like to? Yes.
Chair, Vice Chair, members of the committee, my name is Lona Muckle, and I'm the Senior Policy Associate for the Cash Campaign of Maryland. CASH stands for Creating Asset Savings and Hope, and we promote the economic advancement for low to moderate income individuals and families in Baltimore and across Maryland. We support this bill because requiring businesses to accept cash is a simple but crucial step towards protecting unbanked and underbanked Marylanders from being excluded from everyday economic life. Unbanked are people who do not have access to traditional banking institutions, and underbanked are people who have insufficient access to traditional banking institutions. While cashless payments are convenient for some, they are not accessible to everyone. And for Marylanders who earn a low income, cashless transactions may become difficult. In order to buy merchandise without cash, a person would have to have some sort of financial account, and these can be associated with different fees. HB 191 simply ensures that cash remains an option, so no one is excluded because they don't have access to a bank account. Cashless systems should be a choice, not a barrier. This bill will help ensure that Maryland's economy continues to work for everyone. For these reasons, we urge a favorable report.
Thank you for your testimony. I don't see any questions. Thank you very much. We have one unfavorable. I think Sarah Price is going to testify instead of Kaylee because Kaylee had a family emergency. So Sarah, come on up.
Thank you for your flexibility, Madam Chair. Good afternoon, honorable committee members. Sarah Price on behalf of the Maryland Retailers Alliance. And we do have some concerns with this bill, both as originally introduced and now as amended in the House. The House narrowed the bill to apply only to essential goods, and at that point, we felt that it's frankly unnecessary, as we're not aware of any retailers who fall into those categories who do not accept cash already. But additionally, there is an issue that we feel that the bill, as passed in the House, will be in direct conflict with Senate Bill 893, which I believe was passed out of this body and was heard in the House today, which allows for retail businesses that are accepting cash payments to round in certain circumstances should pennies not be available. And the House Bill 191, as passed in the House, has lines that prohibit a merchant from charging or collecting from a person a higher price than charged or collected for an equivalent cashless transaction. So that line in particular is of concern, as we do feel that the rounding ability is extremely important for businesses right now, as many people are transitioning away from cash, and as we know, the federal government did discontinue minting the penny. So for those reasons, we are unfavorable. Thank you.
Thank you, Sarah. So you think if a retailer has to round up because it comes to 3 cents and he makes it 5, that could be in violation of this bill?
That is our understanding and concern, yes.
Thank you. Do I have any other questions for Sarah? Seeing none, thank you, Sarah. We're going to go to our virtual Anthony Davis from the Maryland Legal Aid. Mr. Davis? Mr. Davis, you can begin.
Thank you. Madam Chair, Vice Chair, members of the Finance Committee. My name is Anthony Davis, and I'm the Advocacy Director for Consumer Law in Maryland Legal Aid. I'm here on behalf of our clients to urge a favorable report on House Bill 191. Maryland Legal Aid serves thousands of low-income Marylanders each year, and for many of them, cash is not a preference, it's just simply what they have. Yeah, as was spoken before, some don't have a bank account, and some can't open one because of old overdraft fees that haven't been settled. And many others simply get paid in cash, like day laborers, babysitters, and a lot of tip workers, and cash is what they use. We believe that House Bill 191 offers a straightforward protection. Generally, stores can't refuse a in-person purchase for essential goods like food, water, hygiene products, medicine, or gas. And they can't require a card or charge more just because someone pays with cash. As the sponsor spoke before, it only applies to certain purchases, and businesses can refuse to accept bills larger than $20 and even provide a cash to prepaid card machine as long as it works and it doesn't charge a fee. I'd ask you to consider someone who's paid by a paper check with no bank account. They have to go to a check cashing place where they pay a fee to cash their check, and then they budget everything down to the last dollar. And if the store doesn't accept cash, they either have to spend more or travel farther. And these are not rare situations. These are everyday problems for the people that we serve. We believe this bill is more about dignity and access, and no one should be shut out from buying basic necessities just because they don't have a card. And it's for these sensible reasons that Maryland Legal Aid respectfully asks for a favorable report on House Bill 191. Thank you.
Thank you, Mr. Davis. Do I have any questions for this witness? Seeing no questions, thank you very much for your testimony. That ends the hearing on House Bill 191. And now we're going to go to House Bill 1625, Public Health Newborn Screening Program, and Fern Clark is going to present for Delegate Hill.
Good afternoon, Chair Bidle, Vice Chair Hayes, and members of the Finance Committee. My name is Fern Clark, and I'm a University of Maryland legacy leader working in the office of Delegate Terry Hill. On behalf of Delegate Hill, I'm here to introduce Bill HB 1625, Public Health, Newborn Screening Program, Fees and Conditions, at the request of the Maryland Advisory Council on Congenital and Hereditary Diseases. HB 1625 updates the Maryland's newborn screening program to ensure sustainability of funding for timely testing and to provide the Secretary of Health with greater flexibility in making additions to the state newborn screening tests based on the federal recommended Uniform Screening Panel, called RUSP, and informed by our expert advice from the Maryland Advisory Council, established for over 20 years. The current law mandates that if the conditions are listed in the RUSP, Maryland must automatically screen for the conditions within 18 months. Since March 2025, there is no federal advisory committee to advise the HHS Secretary of new conditions that should be added to the RUSP. The RUSP becomes a trigger for the Advisory Council to review the conditions as opposed to it being a mandate. Newborns in Maryland are screened shortly after birth to detect rare, serious, and often inherited health conditions and congenital diseases before symptoms appear. Early detections and diagnosis also allow healthcare providers to start treatment immediately, which can prevent or reduce severe lung disabilities, chronic illness, or death. HB 1625 is responsive to an urgent need and improves the process for and the timeliness of adding new screening conditions with FDA-approved treatment to the Maryland Newborn Screening Panel and helps to ensure that the newborn screening program is fully funded to cover laboratory, administrative, and follow-up costs. HB 1625 is important to me because as a mother of 2 children who were born in Maryland, the test results from the newborn screening program confirmed healthy babies in spite of knowledge of or lack thereof family history of heritability disorders. I respectfully urge a favorable report on HB 1625.
Fern, thank you for your testimony. Do I have any questions for this witness? I don't see any questions. Thank you for your testimony.
Thank you.
That ends the hearing on House Bill 1625, and our last bill is House Bill 1526, and it's Delegate Tomlinson, and he's coming with a Carroll County bill, and we have the delegation letter, so thank you.
Thank you. Appreciate it, Madam Chair. Vice Chair Hayes and the honorable members of Finance. For the record, my name is Delegate Chris Tomlinson, and I'm here on behalf of the Carroll County delegation to testify on House Bill 1526. This bill will establish a Class 1 distillery on-premise consumption permit in Carroll County. Under current law, distilleries in Carroll County cannot sell, prepare, or serve food or non-alcoholic beverages, and this bill will change exactly that. These restrictions limit business growth and reduce potential revenue for local distilleries. They also place Carroll County at a competitive disadvantage, as private parties and events often choose venues in neighboring counties that allow for these activities. The bill also ensures proper oversight by requiring approval from the Carroll County Health Department, and it also allows for our Board of License Commissioners, aka our Liquor Board, to set an annual permit fee. House Bill 1526 gives Carroll County's distilleries the flexibility they need to grow, increase revenue, and remain competitive. It also creates more opportunities for residents to gather and support local businesses in their own community. This bill was approved unanimously by the Carroll County delegation and our Board of Commissioners, and also it passed the House unanimously. So I ask for a favorable report. Thank you.
Well done. Do you have any questions for this delegate? Seeing no questions, that ends the hearing for House Bill 1526, and it ends our hearings for today. So for those of you that are here, we're going to vote tomorrow starting at 2 o'clock, which will give everybody time, hopefully, to get their House bills heard. Because they're still, they're still hearing